Okay, thank you very much and good afternoon, everybody. My presentation is related to HIV yield and linkage to treatment in 13 military health facilities in Cameroon. This was a retrospective study. According to the joint United States program, joint UN program on HIV/AIDS, by 2020, 90% of all people living with HIV/AIDS will know their HIV status. 90% of them, that is, all people with diagnosed HIV infection, will have received sustained antiretroviral treatment, and 90% of all people receiving antiretroviral treatment will have viral suppression. And this is the so-called 90-90-90 objectives for the world to eliminate the HIV infection. Therefore, there has been appearance of new and important paradigms or concept, such as the one of case finding, which is also known as yield, which is the absolute number of HIV positive found by site, or the positive rate by a facility, a health facility. The second one is the one of linkage to treatment, and also the third one, which is retention on treatment. Our objective for this study was to determine yield and linkage to treatment levels achieved by 13 military health facilities, but also to compare level of yield achieved by these 13 sites with level of HIV prevalence, and finally to determine possible predictor for those who were successfully linked to treatment. What we can say as what have we identified here as the problem? The problem is that the number of challenges related to the 90-90-90 objectives of the UNAIDS, we have a number of these challenges per facility or also per country. These challenges, the first one is in relation to case finding. That is the ability to detect at least 90% of infected persons. The second challenge is related to the ability to link to treatment at least 90% of all persons screened HIV positive. And finally, the challenge of ensuring that people under treatment continue to be adherent to their treatment. And I have already said, there is then a new concept that will emerge, that is the concept of HIV yield. You will note here that I'm not talking of HIV prevalence, but HIV yield. Once more, HIV yield is the absolute number of HIV positive persons found by health facility. HIV yield represents the capacity of a site to find the potential HIV positive people in a community. And this will be important, as it will be on the basis of that yield that we will be able to provide treatment to those who are infected. In terms of background, this study comes under a fieldwork implemented by Metabata, which is the implementing partner of the Department of Defense for military facilities in Cameroon. And in 2015-2016, the network of these health of these military health facilities included 13 health facilities all over 4 military regions in Cameroon. 5 of them, that is 5 out of the 13, were treatment centers with active files or person living with HIV. And at that moment, the network were having an active file of 3,780 persons living with HIV. Our method during the study, we should first of all state that this was a retrospective study carried out with data abstracted from register from 2015 to 2016 at each health facility. Out of this data, we calculated Z-score and chi-square and performed multiple logistic regression to examine the association between linkage to treatment and some predictors as we identified them in the register, that is the primary source of data. Thirdly, we had a two-tailed testing with p-value less than 0.05 considered as statistically significant. And data were analyzed using SPSS version 24. In terms of results now, 1,837 individuals of 22,518 were found HIV positive. Out of these 1,837, 1,163 were successfully linked to treatment with a linkage rate of 63.3% and a 95% confidence interval lying between 62.7 and 63.9. In age group 15 to 49, HIV yield was 8.1%, whereas in that same age group, the HIV prevalence in the country, that is in the age group 15-49, the HIV prevalence is 4.3%, according to the last study carried out throughout the country. The linkage now, the linkage rate in males was 64.5%, and it was higher than in females, because in females the linkage rate was 62.5% with a p-value of 0.002. That is, when we compare the linkage rate between males and females, it is significantly statistically significant, and then the linkage rate in males, as we said, were higher than the linkage rate in females. In multivariate analysis, facility, unit, and sex were all associated with a decrease in linkage to treatment. We had a decrease of 7% in relation to facility, a decrease of 28% in relation to unit like TB, outpatient, inpatient, and a decrease of 32% in relation to sex. Finally, there was no relationship in increase in linkage to treatment for other predictors such as military region, profession, and so on and so forth. Now, this graph, the first one, display the HIV yield among total person infected or tested in 13 health facilities. And here we can see that the HIV yield is higher in age group between 25 to 49, but also moreover for age group 50 plus, that is person who are more than 50, whereas it is not so high in the other age group, like less than 1 or those who are still who are younger. It looks like there is another graph. There was another graph here which is not displaying. Anyway, in conclusion, HIV yield, linkage to treatment, and retention, which are the main pillars of HIV elimination. These concepts, that is HIV yield, linkage to treatment, and retention, as I said, are the main pillar of HIV elimination. And there is therefore a need to adapt to these new concepts. And for us to do it, whatever the health facilities that we will consider, there should be an early diagnosis of HIV cases, but also an active research or finding of new HIV cases. There should also be, we should make sure that we, as much as possible, we look at those who are HIV positive in various health facilities, because it is within the health facilities that we will be able to find HIV cases. However, we have observed that we were still having a poor level of advanced counseling among service providers. There is then a need to improve not only on advanced counseling, but also in the active linkage of those who are screen positive. That is why the health facilities, but also the health system, has now decided to go for test and treat. That is, as soon as a person is tested, is directly linked to treatment. We should also have a focus on those less likely to be linked to treatment, in particular females, as we have seen that the rate of linkage was higher in males than in females. And here you can see the references, some of the references that are used for the study. Thank you very much for your kind attention.